So the unresolved state of mind in patient and or therapist. You know, there's a whole lot that could be said about, you know, those of us who have experienced trauma, whether we're therapists or patients or both. There's a whole lot that could be said, but one thing that I want to communicate is that, you know, number one, I think as a therapist who has some personal familiarity with trauma, which I think many of us do, well, I guess maybe I'm just going to underline what I've said a couple of times already, which is that our vulnerabilities are a legacy of our suboptimal, if you will, attachment history. But I think also some of our resources, some of our capacities for empathy, for understanding, for, you know, helping other people on, you know, what I've called this journey from dissociation to something more like wholeness. I think all of that too is a part of the legacy of a history of trauma. Now, I think, in a sense, on the negative side of the ledger, I think when a therapist who has experienced trauma confronts a patient in an unresolved state of mind, I think it can be at times exceptionally easy to feel triggered, to feel emotionally engaged in ways that may make it difficult for us to think straight, in ways that may make it difficult for us to function as therapists in the way that we might, in some theoretical universe, feel we ought to be functioning as therapists. You know, so as I say, that's kind of on the negative side of the ledger. At the same time, I think whether or not we know anything about trauma at first hand, it's likely that we're going to be emotionally activated by patients who themselves have a history of trauma. And I think there's a couple of explanations. Well, I think there's one primary explanation for this, which is that people who have been traumatized tend to make use of the defenses I alluded to earlier, dissociation and projective identification. And if patients are sort of, you know, relocating their badness and their shame and their terror and their rage, if patients are relocating those kinds of emotional experiences in other people to protect themselves, then those other people are quite naturally and perhaps inevitably going to be, as I say, emotionally activated. And I think understanding, you know, that you're bound to be emotionally activated can be somewhat helpful. In other words, to realize that this isn't some mark of your failure as a person or a therapist, that in fact this is just kind of what happens when working with certain kinds of people with certain kinds of histories. I think maybe you can be a little bit less hard on yourself. I think, by the way, this is what some writers have called objective countertransference, meaning it's not so much a function, or at least not alone, of your subjectivity and your idiosyncrasies as a person, such that you start to feel very anxious when you're with this person, or very agitated when you're with this person. There's something more objective about these kinds of countertransference responses. So I think that's helpful to understand. And then I guess I said A, so what's B? Well, I think B is the objective countertransference, if you will, when you're working with somebody who has been traumatized. I think the objective countertransferences that you experience are in some ways a mirror of the self states that the person in an unresolved state of mind is likely to experience. In other words, your experience is in some ways a mirror of the patient's experience, and the self states of someone who lives in an unresolved state of mind with respect to trauma. It has been suggested by writers like Giovanni Leotti, who's I think actually originally a cognitive behavior therapist, but also an attachment researcher in Italy who has studied disorganized attachment in childhood and adulthood, and he has a special interest in dissociation. In any case, Leotti has suggested, as have a number of other writers, that there are four characteristic self states that are part of the inheritance, psychologically speaking, of someone with a history of trauma. And these four self states are as follows. Number one, the sense of oneself as a victim. Number two, the sense of oneself as a victimizer. Number three, the sense of oneself as a rescuer. And number four, the sense of oneself as a cognitive incompetent. In other words, the sense of oneself as a kind of space case, somebody who can't think clearly. And it seems to me that those four self states, which I think characterize the psychological world of someone in an unresolved state of mind, these four self states I think also characterize, you might say, the countertransferences which we're likely to experience as we relate to someone in an unresolved state of mind with respect to attachment. And I think, just to reiterate, if we have ourselves experienced trauma, I think we're exceptionally vulnerable to having any one of these four self states triggered in us as we relate